Welcome! This is a brief description of First Link Dementia support offered by the Alzheimer's Society of BC. The sustainable approach to dementia care leverages the unique expertise and experience offered by both healthcare organizations and the Society to expand the continuum of care for families living with dementia. First Link Dementia support offers innovative programs that can supplement the work you do. The Alzheimer's Society of BC's ultimate vision is a world without dementia. Until this day comes, we are committed to building a world where people living with dementia, their caregivers, and their families are included, acknowledged, and supported. A truly dementia-friendly society. Our goal is to ignite a movement, and BC's continuing care sector has a key role to play. Your referrals to First Link are part of our mission to mobilize the greater community of care around people affected by dementia. Actually, describing First Link Dementia support is pretty easy. First Link Dementia support connects individuals and families affected by Alzheimer's disease or other dementias to a community of learning, services, and support through the dementia journey, ensuring that people affected by dementia are not alone. So let's dig into that a little bit. How does First Link work? A simple referral process allows doctors and other healthcare providers like you to refer people with dementia and/or care partners to the Society at the time of diagnosis or any time along the journey. In fact, people do not actually need the diagnosis to be referred to us. We know that earlier is better to allow families to start planning for the future, while the person with dementia can still contribute to decision making. But First Link Dementia support is still tremendously helpful to families at any point during their dementia journey. Alzheimer's Society staff will contact the family on an ongoing basis from the time of referral through to the end of life if the client still needs that support. The diagram on the slide represents the continuous cycle of ongoing contact and connection to support, education, and information that meets clients' needs at any stage along the journey. So, who should refer to First Link? Ideally, any healthcare provider. GPs, specialists and assessment clinics, acute care staff, and mental health teams can make the referral at the time of diagnosis or any time thereafter. But as mentioned, earlier is better. The diagnosis can be any type of dementia, not just Alzheimer's disease. All care partners should be referred regardless of whether or not they are displaying signs of caregiver stress. Access to services early can help mitigate some of the negative consequences of caring before they occur. We can give them tools to help avoid or cope with the stress before it becomes a problem. Home and community care, specifically case managers, should refer any care partners who are not already connected to our services. We can help connect them with caregiver support groups, education about dementia through webinars and videos, and other support and education opportunities they are likely already coping with a great deal of stress at this point. But our support services will be able to help them cope. Staff in long-term care can refer care partners who are having difficulty adjusting to the transition or to changes in their person. The Society has education workshops and support groups to help them cope. Dementia is a disease that affects the individuals diagnosed and their whole families. As a care partner said so eloquently, he has the diagnosis, but we are living with the disease. Our services are designed to meet the needs of people living with dementia in the early stages of the disease and their care partners throughout the progression. Because of the stress and stigma associated with the diagnosis of dementia, it can take families time to adjust to their new situation. On average, it takes families 11 months longer to connect to First Link for help, whether they find us on their own or their doctor or healthcare providers suggest they contact us or visit our website. And just to underline that point again, on average, the difference in the time to connect to services between a formal referral and just recommending to your client that they contact us is an average of 11 months. A referral at the time of diagnosis ensures that families are being supported during the time that can be critical for advanced planning and developing support networks. For learning about the disease and adapting strategies for living well with dementia. One of the real values in a healthcare provider like you referring an individual or family to First Link dementia support is that we reach out to families no later than 3 weeks after receiving the referral. The onus is taken off the families to initiate the connection, which for many people is a difficult thing to do. Once the connection is made, we work with care partners to determine what support services most suit their needs at any given time, and this continues to evolve along the progression of the disease. This diagram demonstrates how access to the Society's programs and services flows from First Link referrals. A referral to First Link connects people to all of our various programs and supports. We help clients plan for the future so that the person living with dementia is included and supported to live well with dementia for as long as possible. So what does First Link Dementia Support offer to your clients? As mentioned, we offer proactive telephone support to families on a regular basis. And while our in-person programming is suspended due to COVID-19, we are reaching out even more regularly if needed. This takes the onus off your clients. We offer ongoing access to support and learning opportunities for every step of the journey, including support groups for caregivers and both support and social groups for people with early symptoms of dementia. These groups connect clients to a supportive community of others impacted by dementia. Our Minds in Motion Online is a social and fitness program for people living with any form of early stage dementia and a care partner. Clients can access dementia education through weekly webinars and over 50 education videos to help build the knowledge, confidence, and skills to live as well as possible with the challenges of dementia. We regularly point clients to other community resources and agencies as well, to give clients a good sense of what support services are available in their own communities. To find out more about any of our programs, please call the First Link Dementia Helpline at 1-800-936-6033. English services are available Monday to Friday from 9 a.m. to 8 p.m. And incidentally, that too is a service that is available to anybody in the province. Cultural and language-specific support is available in Cantonese, Mandarin, and Punjabi. What's the benefit to you? First Link offers a simple referral process that can happen at any point in the progression of the disease. I know I've said this several times now, but although the time of diagnosis is the optimal time to refer so that families get connected to services as soon as possible, a referral to First Link Dementia Support is helpful at any point. Care partners can be referred even if the referring professional is not in a direct care relationship with the person living with dementia. You can receive regular updates about dementia education and support opportunities that we offer. Your clients will be supported between clinical visits, and you will know they are connected to reliable services that can help them manage the disease. Making a referral is more than just telling patients or clients about us. It's about explaining to them how the person living with dementia and their care partners will benefit from our support. A referring professional told us that they find this simple referral doesn't get people to our programs, and they asked us that we pass along their suggestion to you, their colleagues. Please add some encouraging words and reassurances when you are discussing the referral to First Link Dementia Support. Many of our clients living with dementia have also told us clearly that they want people who are newly diagnosed to know that the diagnosis is not the end of a meaningful life. There is often a long journey ahead for most people. As you likely know, people are often shocked and reeling after they hear the diagnosis, and referring them to us is something that can make a huge difference in the coming months and years. You can help your clients by letting them know that they need to prepare for the dementia journey and that they don't have to make this journey alone. We are going to reach out and help them to maintain their quality of life as much as possible. The referral form can be accessed through the Alzheimer's Society of BC's website, through our staff, or it can be accessed through the Med Access EMR, Wolf EMR, or the Pathways web-based directory. Receiving a referral form tells us that you have had the conversation with your patients or clients about our services and that we have their permission to reach out to them. The form is sectioned to quickly capture your information, the information about the person living with dementia, the contact person, and a place for comments. You may have little information about the person who's living with dementia if they are not your client, but please do include what you have. Please note as well that a caregiver can be referred even if the referring professional is not involved with the care of the individual living with dementia. We connect with folks within 1 to 3 weeks of the date we receive your referral, unless you specifically request a different time frame. If, for example, your patient is immediately going traveling for 2 months and you recommend we don't reach out until their return. To find the downloadable referral form, go to www.alzheimerbc.org and click in the search bar and search for resources for healthcare providers. The link to the referral form is near the top of the page of resources for healthcare providers in BC. So I have a couple of stories to illustrate the impact of what we do. A few years ago, I was doing a presentation for people who had family in long-term care. Someone asked what happens to the brain, and so I brought up a picture that shows the shrinkage of a brain with Alzheimer's disease compared to a healthy brain. A man in the room gasped and said, "Oh my goodness, you mean this is a real disease?" The expression on his face was literally one of shock, and he said that for all these years he thought his wife was making stuff up and it wasn't really real. He also said that no one ever told him what dementia was. I wish we could have connected with him so much earlier. Now a little story about someone who connected so much earlier. Several years ago, I taught a class to people living with dementia in the very early stages and their care partners. At the end of the class, an older lady came up to me and told me that her memory is not very good these days. She said she was glad she came today because I made her feel less afraid. I have to say, I had a hard time not tearing up that day. It can be so powerful when we connect with folks at the right time for them. Here is what Eve Lyon, a social worker and referring professional, said. We may only see an individual or family once or twice, but with a first link referral, we know that they will be provided with ongoing support. Thank you for your time. And again, our First Link Dementia Helpline is for anyone affected by dementia, whether professionally or personally. If you have any questions about our services or how to refer someone to First Link, please call. English services are available Monday to Friday from 9 a.m. to 8 p.m. and cultural and language-specific support is available in Cantonese, Mandarin, and Punjabi from 9 a.m. to 4 p.m. again on Monday to Friday.